We have a special guest to discuss the financing of the fight to end the COVID-19 pandemic with a focus on ACT Accelerator and in the context of the G7, G20, and that is Gordon Brown, United Nations Special Envoy for Global Education and former Prime Minister of the United Kingdom. Welcome. Simultaneous interpretation is provided in the 6 official languages: Arabic, Chinese, French, English, Spanish, and Russian, plus Portuguese and Hindi. Let me introduce the participants in the room. Here are Dr. Tedros Adhanom Ghebreyesus, WHO Director General, Dr. Maria Van Kerkhove, Technical Lead on COVID-19, Dr. Soumya Swaminathan, Chief Scientist, Dr. Maria Angela Simão, Assistant Director General for Access to Medicines and Health, and we have online Dr. Mike Ryan, Executive Director for Health Emergencies Program at the WHO. With this, let me hand over to the Director General for the opening remarks. The floor is yours.
Thank you. Thank you, Christian. Good morning, good afternoon, and good evening. Earlier today, the government of the Democratic Republic of the Congo announced the end of the most recent Ebola outbreak, 3 months after the first case was reported in North Kivu. I congratulate the government, health workers, communities, and all WHO staff who were involved in the response. This has only been possible thanks to a concerted, comprehensive, and consistent approach using vaccines and therapeutics alongside proven public health measures with empowered and engaged communities. COVID-19 is a very different disease, but the approach is the same. The absence of any one of these key measures presents a weakness that this virus will exploit, as we are seeing all over the world. More cases of COVID-19 have been reported globally in the past 2 weeks than during the first 6 months of the pandemic. India and Brazil account for more than half of last week's cases, but there are many other countries all over the world that face a very fragile situation. In India, WHO is providing critical equipment and supplies, including oxygen concentrators, lab supplies, and mobile field hospitals. We're also providing advice for people on how to provide care at home for families that are unable to find a hospital bed. For patients with severe or critical disease, WHO recommends treatment with dexamethasone. And WHO and the WHO Foundation are raising funds to support the need for oxygen and related supplies globally. In the meantime, we call on everyone to continue to follow WHO and national advice on keeping safe, maintain physical distance, avoid crowds, wear a well-fitted mask that covers the nose and mouth properly, open windows, cover coughs and sneeze, and clean your hands. What's happening in India and Brazil could happen elsewhere unless we all take these public health precautions that WHO has been calling for since the beginning of the pandemic. Vaccines are part of the answer, but they are not the only answer. On Friday, WHO gave emergency use listing to Moderna's COVID-19 vaccine, making it the 5th to receive the WHO validation. Emergency use listing is one prerequisite for vaccines to be purchased and supplied through COVAX. It also allows countries to expedite their own regulatory approval and to import and administer a vaccine. And we're pleased to note that Gavi has signed an agreement with Moderna for 500 million doses of vaccine on behalf of COVAX. This morning, I met with Sweden's Minister for Development Coordination, Minister Per Olsson Frid, who informed me that Sweden will donate 1 million doses of AstraZeneca vaccines to COVAX. Tack så mycket, Sweden, for this donation, which allows similar donations by France, which follows similar donations by France, New Zealand, and Norway, with positive signs from some other countries. And we call on all other countries to follow the example these countries have set and donate through COVAX to help accelerate equitable distribution and access. COVAX has now shipped almost 50 million doses of vaccine to 121 countries and economies. But we continue to face severe supply constraints. Solving this dilemma demands courageous leadership from the world's largest economies. Next month, leaders from the G7 countries will gather for what may be the most significant meeting in its history. The G7 countries are the world's economic and political leaders. They're also home to many of the world's vaccine producers. We will only solve the vaccine crisis with the leadership of these countries. The Access to COVID-19 Tools Accelerator currently faces a funding gap of $19 billion. And we estimate that we will need a further $35 to $45 billion next year to vaccinate most adults around the world. The G7 countries could mobilize a substantial portion of these funds themselves and lead a global effort to accelerate vaccination around the world. We face a shared threat that we can only overcome with shared solutions, sharing financial resources, sharing vaccine doses and production capacity, and sharing technology, know-how, and waiving intellectual property. Today, it's my great honor to be joined by Gordon Brown, the former Prime Minister and Chancellor of the Exchequer of the United Kingdom. As Prime Minister, Mr. Brown has hosted the G20 summit in 2009, when under his leadership, the G20 countries committed to making an additional $1.1 trillion available to alleviate the most acute economic crisis since the Great Depression. We now face an even more severe crisis, and we need the same kind of leadership. Gordon, thank you so much for your leadership, and thank you for joining us today. You have the floor.
As Dr. Tedros has just told us, each week for the past 10 weeks, we've seen increases in COVID cases worldwide. Last week was one of the worst, with nearly 5.7 million new confirmed cases reported and over 93,000 new deaths. And with many communities, healthcare centers in India, Brazil, and elsewhere simply overburdened, overwhelmed, and under-resourced, we are at this critical moment in the fight against COVID-19. And we are face to face with this unanswerable truth that no one is safe anywhere till everyone is safe everywhere, and no country can finally be COVID-free until every country is COVID-free. And for his repeated and accurate warnings to us, and for his impassioned leadership, I want to praise my friend Dr. Tedros and his brilliant staff, and all those across the world who through ACT Accelerator and COVAX are working for vaccine equity. For while the near majority of US citizens and the majority of UK citizens have already received one COVID shot, in hard-hit India, just 10% have been vaccinated. And months since the vaccine became available, less than 1% of sub-Saharan Africa. And this is a man-made catastrophe, because while it took 9 months to reach 1 million deaths when we had no vaccine, in only 4 months since we've had a vaccine, we reached 2 million deaths, and in only 3 months since, 3 million deaths. 1 in 2 vaccinated in much of the West, less than 1 in 100 in sub-Saharan Africa. By our failure to extend vaccination more rapidly to every country, we are choosing who lives and who dies. And I say the world is already too deeply divided between rich and poor to allow a new unbridgeable divide to become entrenched between the world's vaccinated who live and the unvaccinated who are at risk of dying. And it's not only the poor who suffer, all of us do. The longer the poorer countries go unshielded, the more the disease will continue to spread, mutate, and threaten not just poor countries, but rich countries too, including the already vaccinated. So this is a global problem that needs the globally coordinated solution Dr. Tedros has just mentioned. To protect ourselves locally, we need to act globally, with a concerted and immediate push to mass vaccinate the world, underwritten by the richest countries to help the poorest, and not as an act of charity, but as a matter of national security for each of us, as the best insurance policy in the world. For the words of President John Kennedy, spoken 60 years ago, ring even truer today. If a free society cannot help the many who are poor, it cannot save the few who are rich. Now, the miracle that is science has given us multiple vaccines, and assisted by licensing agreements and I hope a temporary patent waiver as proposed by People's Vaccine Alliance, manufacturing can be ramped up in every continent soon. But I want to address the biggest question the poorest countries still have no answer to. Who will pay? The cost to a low-income country is prohibitive. The double vaccine at $10 can be an entire week's income for a family. But for our richer countries, the bill for mass vaccinating the world and ensuring access also to tests and treatments is affordable. A total of around $30 billion a year is spread across the richest countries, means just 25 cents a week per citizen. And it is money we cannot afford not to spend. For mass vaccination is not just an epidemiological and ethical imperative, it's an economic imperative. For if the cost of vaccines is in billions, the overall savings is in trillions, trillions of additional economic output made possible when trade resumes in a COVID-free world. Helping vaccinate the rest of the world will cost America up to $7 billion a year. And that's less than 0.5% of the cost of its $2 trillion economic stimulus. And yet the resumption of trade and economic activity that a virus-free world makes possible in 2021 alone will be worth 10 times as much to America. Now, I want to pay tribute to the ACT Accelerator and COVAX. It has raised $14 billion for tests, treatments, vaccines, and PPE. It's signed up 190 countries to COVAX. It has mass secured nearly 2 billion vaccines for the 92 poorest countries. And it sends a message that when it comes to preventing loss of life, we cannot rely on charity alone, but need a systematic plan that does not force us to choose between who lives and who dies. But ACT-A has yet to raise 19 billion this year, and will need more if we can ramp up manufacturing even more quickly. And in total, over 2 years, we need to raise an estimated $60 billion, not only to cover vaccines, research, production, and distribution to 92 lower income countries, but help pay for vital medical supplies, diagnostics, and medical oxygen currently and shamefully in short supply in India and elsewhere, as Every Breath Counts has shown. Now, based on ability to pay, and that's a formula that takes into account national income, current wealth, and benefits from the resumption of trade, America would pay 27% of the cost, Europe 23%, the UK 5%, Japan 6%, Korea and Australia, who will attend the G7, and Canada 2% each. And I say to the G7, the forum that brings together the world's richest countries, you have the power and the ability to pay for nearly 2/3 of the costs and secure a historic breakthrough by agreeing an equitable burden sharing formula that could cover global health provision. And you can expand IFM with grants for low income countries and create guarantee-based facilities for middle income countries that will maximize available resources in future years. And I say to the G20, with your leadership, we can cover over 80% of the costs. And you have the means to urgently donate vaccine doses, as Dr. Tedros has said, to cover the gap in supply. I say to the richest 30 countries in the world, you can cover almost 90% of the costs. And the same burden sharing formula can also be applied so that instead of the familiar pandemic cycle of panic now and neglect later, the world invests now when there is a cash shortfall and for the future in pandemic preparedness, as Helen Clark's WHO review will highlight, to ensure that even if future outbreaks happen, pandemics become preventable. And I say directly to the leaders of the World Bank and all multilateral development banks and to the IMF, your responsibility also is clear. We, the shareholders, want to instruct you to ensure low and middle income countries can invest in building up their currently understaffed and under-resourced primary healthcare systems that are now at breaking point. And I say to those countries, respond now to the invitation this week from the WHO to submit national capacity building plans so we can ensure delivery of vaccinations and treatment without it being at the cost of so many needs in healthcare that are now not being met. And I want to promise Dr. Tedros and all the world's health workers who are selflessly laboring night and day to save lives, in the next few weeks, we will ensure you have the support from the leaders of Asia and Africa and from Asian and African civil society demanding the G7 Act. Support from economists showing that we cannot afford not to act. From medics and scientists demanding the G7 deploy its wealth to end the disease. From people all over the world, just as the LA Concert of Global Citizens did last night, demanding the world now come together at this moment of great peril to save lives. And I say to all with the power to change our world for the better, time is short. We must act in days rather than in months. Let us not repeat the mistakes of the first wave of the disease when the world's failure to cooperate across borders contributed to the loss of 3 million lives. Martin Luther King spoke of the fierce urgency of now, reminding us that in a crisis, there is such a thing as being too late. A crisis like this, he told us, is no time for apathy or complacency. It's time for vigorous and positive action. And we need that now, building on what Dr. Tedros has done, starting immediately by vaccinating every country's health workers, elderly and priority populations. Let us secure vaccines, tests and treatments for all. And let us begin to reunite our fractured world. Thank you very much.
Thank you. Thank you so much, Gordon. And thank you once again for your clear and powerful call to world leaders. Finally, I would like to recognize 3 important days that we are observing this week. First, today is World Press Freedom Day. WHO values the role of a free and fair press in informing the public and in holding governments and institutions accountable. Second, Wednesday marks World Hand Hygiene Day, a reminder that clean hands save lives. And third, Wednesday also marks the International Day of the Midwife, an opportunity to celebrate the vital role that midwives play every day of every year, and especially during the past year. Christian, vielen Dank, back to you.
Thank you so much. With this, we start the round of question and answers, and we'll start right away with Robin Millar from AFP. Robin, please unmute yourself.
Thank you. On supply to COVAX, there's been some positive COVAX announcements today, as you've mentioned, including Sweden's donation of 1 million AstraZeneca doses. How far does this go towards filling the gap left by the halt in access to AstraZeneca doses from the Serum Institute of India? Do you have any indication when COVAX might regain access to AZ doses from India? And how are negotiations going on convincing the United States to donate its doses via COVAX? Thank you.
Robin, thank you very much. And let me again remind everybody, please, to ask 1 question only, so we can actually manage to get through a couple of more from you. So thank you, and I'll hand over to Dr. Bruce Aylward, who's joined us in the room. Bruce, over to you.
Thank you very much, Christian, and thank you for the question, especially inquiring on what's happening in terms of the supply of vaccines to COVAX, because as most on the line know, COVAX was established to ensure that we can get doses out in as equitable manner as possible around the world. The crucial thing is getting the doses into COVAX to be able to distribute them in that way. When we look at the interruption in supply for the current period as a result of the need to redirect doses in India, there's about 20 million doses of vaccine that was procured from the Serum Institute of India that was shipped around the world to countries outside of India, and they've now all used their first doses. So what we're trying to urgently do is ensure that we can close the gap, first of all, to get another 20 million doses to those countries so they can get their second doses into those populations. And then, of course, we need to deepen the coverage. Even that will only reach a very, very small proportion of the population. But the first goal is to try and ensure we can get those additional doses. So the 1 million doses that were announced today by Sweden is extremely important, because those are unearmarked doses that go into COVAX, and what they're saying is, look, you make sure they go to the places that need them in the right order to get them those second doses, or if there's places who've not received doses at all. But as we look forward, there's an even bigger gap, because that's only, that 20 million was a fraction of what we'd actually procured through, or what the COVAX facility had procured through the Serum Institute of India. We'd actually been expecting over 100 million additional doses during this period. So that's still a much bigger gap that we need to try and close. We are hopeful that the crisis in India, everyone is hopeful that that crisis is going to reverse quickly, that the numbers will start to go down, and that the country will be able to start exporting doses of vaccine again. That's in everyone's interest. But right now, we don't actually have a firm date for restarting doses, but we do hope it will be in the near future. There was a question as well, I think, sorry, Christian, a third question about other countries, and certainly the COVAX facility and the key partners, Gavi, ourselves, others have been in discussion with many countries, the UK, the US, Canada, the EC, countries within the EC, and others beyond, Australia, New Zealand, all countries that have contracted substantial numbers of doses, about the possibility of ensuring that they get any additional doses get distributed or shared through COVAX. So those discussions are ongoing with a broad number of countries.
Thank you very much. Dr. Aylward and Dr. Swaminathan to add.
Thank you, Christian. Just to briefly add to what Bruce said, we really welcome the donations by France, New Zealand, Norway, and now Sweden. And we believe that if many other countries who have adequate supplies for their own populations and are scaling up vaccination of their own populations, if they could also set aside a certain percentage for COVAX, this would help to meet the gap. In the next few months, we do not expect Serum Institute to be able to supply the kind of volumes that were originally predicted. So we need to meet that gap. And so it would be really helpful to get AZ doses from other countries, as Bruce mentioned, in Europe and beyond. We're also talking to the United States, who has committed to sharing their 60 million doses of AstraZeneca vaccine that they have, and we're hoping that that would also flow through COVAX to help not only India, but other countries as well. And finally, we're also talking to Moderna, which just received the emergency use listing, and there is a deal that's being signed with them for 500 million doses, but this would start in the second half of the year and continue through 2022. So we're exploring all options with companies with existing deals with COVAX, as well as companies that are still coming on board. And we need to get to our goal of about 2 billion doses being distributed to AMC countries by the end of this year. So every bit helps. Thanks.
Thank you very much, Dr. Swaminathan. And we move on to the next question, and that comes from Ketawan Kardava from Georgia TV. Ketawan, please unmute yourself.
Hello, can you hear me?
Very well, please go ahead.
Thank you very much. I have a question concerning Chinese vaccines. As Georgia is going to start vaccination from tomorrow with Chinese vaccines, so we want to know more. And can you update us when will you finish the assessment procedures? Thank you very much.
Thank you. Thank you very much, Karavan. That's for Dr. Simao, please.
Thank you. Thank you for the question. And let me say that we are finalizing the assessment of Sinopharm. There is still some documentation that needed to be added, but it should be closed this week, and we will start the final assessment for the listing of Sinovac on the 5th, which is the day after tomorrow. So we expect both the Chinese vaccine, Sinopharm, this is Sinopharm Beijing, BP or something, not Sinopharm Wuhan, and we expect that both of them will be finalized by the end of this week. Thank you.
Thank you very much. And next question goes to Siddhant Mamtani from Times India, I assume. Siddhant, please unmute yourself.
Hello, am I audible?
Yes, go ahead.
Thank you so much. So my question is regarding the vaccination program launched by the government of India. The situation, as we all know, is very serious in most parts of India, and while there are 4 lakh cases almost coming every day, there are reported almost 3,500 deaths per day. With the vaccination program, vaccinating about just little more than 10% of India's population, do you think that, especially keeping in mind of the situation, a more robust, more aggressive vaccination program is required in India? Thank you so much.
Thank you very much, Siddhant. We'll start with Dr. Swaminathan, please.
Yes, thank you for that question. I mean, vaccination definitely is one of the tools we have against COVID, and it's a very important tool, which will be particularly important for the end game. And we've seen in country after country now that as you reach about 50% population coverage, you start seeing significant reductions in cases, and you see that reduction in deaths, even earlier, as the priority populations are covered first. Now, a country like India has about 1 billion people to vaccinate. So this is not going to happen overnight. It is going to be a mainstay, and I think India has done well in terms of rolling out the vaccination program, in using the private sector and the public sector to do that. The limitation, of course, right now is the supply. If the supplies could be higher, I'm sure that they could vaccinate many more people every day. But having said that, the program will take some time to have an impact on what we're seeing now, the incidence of the disease. This is not going to come down by vaccination, because you need to get to that level in the population to really start having an impact. So it is going to be, for the foreseeable future, it is going to be the reliance on the public health measures, on the distancing, the testing, tracing, and isolating, taking care of those who are sick, universal mask wearing, avoiding crowded places, stay home wherever possible. Everything needs to be done in order to bring down, the force of transmission in the community just now, which is extremely high, as we see from the test positivity rates. And we have to be also careful. Vaccination centers do not become places where the infection is being transmitted. So the same rules need to be maintained as far as possible. People waiting outdoors rather than indoor, everyone masked up, maintaining distance, etc. So there's a global supply shortage of vaccines, and the same applies, to India. There's only a certain amount of capacity. So as that is scaling up, we need to do the other things, and maybe Maria might want to add to what the local epidemiology is telling us.
So thanks, Soumya. Not too much more to add from you, because you gave such a comprehensive answer. I think the point is that it's vaccines and so as Soumya has said, vaccines, and as you've heard us say, vaccines and vaccination is a tool that we can use. It doesn't have an immediate effect, though. It will take some time to actually reach those who are most in need, and have an impact on severity and on death, as well as on transmission, because we are seeing some hopeful signs that vaccination is also reducing transmission, even though those studies aren't yet completed. It's about all of the other factors that are put in place. And the comments that we have for India are the comments that we have for other countries as well. There are a number of countries in all regions of the world right now that have some worrying trends, that have some worrying signs of increasing case numbers, increasing hospitalization rates and ICU rates in countries that don't yet have access to the vaccine, who have not reached the coverage levels that are needed to really have that impact on severe disease and death and on transmission. And so it is about doing everything that we can. The most important thing, in the many important things that we can do right now, is limit the number of contacts that we have. And so our physical distance is really critical, avoiding gatherings, avoiding mass gatherings especially. And if you can do things outdoors, do them outdoors compared to indoors. If you are indoors, make sure that you have good ventilation. It's as simple as opening windows if it's safe to do so, making sure that you wear a mask, making sure that when you wear a mask you have clean hands, making sure that you practice respiratory etiquette, stay home if you're unwell, follow the local guidance. The intensity of transmission around the world is very different, and so it does, the level of intensity of the measures that you take depend on where you live. So it needs to be guided by the local epidemiology and the advice that is given. If you can stay home, if you can work from home, if you are privileged to do so, please do so if you are supported in that. That takes the pressure off public transportation systems. It takes the pressure off of those individuals who have to go into work, who cannot stay at home. And it takes the pressure off of our frontline workers. So everything that we can do, I mean, I know some people are in a fortunate situation where transmission is down and they're saying that the pandemic is almost over. This pandemic is far from over. And we are all in this together. So if you are living in an area where transmission is down, continue to do what you can to keep transmission down, because you don't want it to take off. You don't want to give it the opportunity to resurge. What we are seeing in India, what we've seen in Brazil, what we saw in the United Kingdom, and in many parts of Europe, just after the Christmas, New Year's holiday. This can happen in some locations around the world if we let it happen. So it's a plea. WHO has a no regrets policy. We ask that you follow that same policy where you live. Don't put yourself at risk if you can.
Thank you very much. And that was Dr. Maria van Kerkhove, of course, technical lead on COVID-19. We're checking if Gordon Brown may want to add on this one.
No, I'm happy to take any questions about the financing if people have them.
Very well, so thank you very much, sir. We'll continue with the next one, and that's Karl Maurer from ARD Radio. Karl, please unmute yourself.
Thank you for taking my question. Dr. Tedros, you touched the topic already a little bit earlier. What are your hopes, your confidence regarding the process of the WTO negotiations on intellectual property regarding vaccines, and what impact could it have for vaccination programs as COVAX?
Thank you very much. And Dr. Tedros, please.
Yeah, thank you. Thank you so much. As you know, there is an acute problem, and the acute problem is the vaccine access now. Some countries have started, some haven't. And those who have started, they face shortages, and we need to provide vaccines for them for their second round and for their booster. The other problem is for the long term, that is, we need to have a significant level of vaccination rate that may amount to bringing herd immunity. And if we're going to vaccinate majority of the adults to bring herd immunity, then the amount of vaccine we need will be significantly more than what we have now. So the production capacity should increase, and that's why the IP waiver will be very important. And I would like to thank South Africa and India for proposing the IP waiver. We see more countries joining South Africa and India in favor of IP waiver, and I hope other countries will be convinced to make this a reality. Of course, from the process so far, we have seen how difficult it is. But what's very striking is if we cannot use all means we have at hand now, including the IP waiver, when are we going to use the IP waiver? Because the pandemic is happening in 100 years, and even the provisions in the TRIPS agreement were meant to use IP waiver for emergency conditions. And the level of emergency we're in now is unprecedented. So the question again, I repeat, is if we cannot use it now, when can we use it? So we hope the global leaders will realize this and agree to use all means at hand, starting from the voluntary sharing, which we have been advocating for before, using all options to increase production as soon as possible and increase vaccination coverage as soon as possible. And this is in the interest of each and every country in the world. With now especially variants popping up in many countries, it's not a charity issue. It is an issue that is in the interest of all countries, each and every country, in order to stop the virus or to stop the pandemic. So there are progresses now. There is encouraging progress, more and more countries joining, but we need to complete the process as soon as possible and decide, because there is no reason, to be honest, to not decide on IP waiver, because the provision was meant for this situation. The provision of waiving IP was meant for this condition, for emergencies, and this is unprecedented. Thank you. And I hope Gordon might add to this, please.
Just to follow Dr. Tedros, there are, I think, a large number of people and companies who would be prepared to manufacture in Africa and in other parts of the world where manufacturing is not happening. But I think they do need either licensing agreements or a temporary waiver to be able to do so. And I do distinct a change in the last few days in the way people have approached this issue, because while there was a rejection originally at the WTO a few weeks ago, I do think from remarks from President Biden and his staff and others that serious consideration is now being given. And of course, the G7, as Dr. Tedros said a few minutes ago, are the group of countries which include many of the vaccine developers and the vaccine originators. And therefore, if they could make a decision that they collectively would support a temporary waiver, I think that'd be a huge advance. It doesn't solve the problem of finance, because we have still got to finance the actual production and manufacturing, distribution and logistics of the vaccine. And we still have to fund testing and all the therapeutics and diagnostics. But it would be a major advance. And of course, the TRIPS agreement, which I know about from my period in government, was designed so that if an emergency happened, something like this, a temporary waiver could happen. So I support everything that Dr. Tedros has said. And I hope that the G7 and other countries will now discuss this seriously as one of the ways forward to solving the problem.
Thank you so much, both. We'll move on to the next question. That's Corinne Gretler from Bloomberg. Corinne, please unmute yourself.
Hi, thanks for taking my question. It's really just a housekeeping question on the Sinovac and Sinopharm emergency use listings. Is the plan to send out a statement on both of them, or should we be expecting two separate releases later this week?
Dr. Simao, please.
Thank you, Corinne. It's a good question, because they are at different stages. Because Sinopharm started to be the final assessment of Sinopharm by the WHO's expert advisory group started last week. And like I said, there were still some final arrangements to be made for the decision to be made. So, and while Sinovac will only start on Wednesday, right? So it depends a lot on how it evolves. We expect that we'll have both decisions by the end of this week, but if Sinopharm's the final decision is finalized before Sinovac, we will make it public as soon as possible, because we know that some countries depend on this decision to proceed with their vaccination. Thank you.
Thank you very much for this clarification, and we'll continue with Priti Patnaik from Geneva Health Files. Priti, please unmute yourself.
Hi, can you hear me?
Very well.
Thank you for taking my question. One question perhaps for Dr. Maria Vankakov or one of her colleagues on the status of the sharing of genomic information on the different emerging variants in India. Reuters reported last week that there seems to have been some concerns on the collection and sharing of epidemiological data. And we understand that WHO has not yet declared the variant B1617 as a variant of concern, as it did for the variants that emerged in Britain, Brazil, and South Africa. And correct us if you are wrong, that it's only classified as a variant of interest because there's no evidence to support otherwise. Is this connected to a lack of sufficient data? Can you comment on this? Thanks.
Thank you very much, Priti, and that goes to Dr. Van Kerkhoff.
So thanks very much for this question. Yes, indeed, the B1617 has been classified as a variant of interest. And what WHO does is that we have characterizations of variants of concern and variants of interest at a global level. So currently we have 3 variants of concern at the global level: the B117, first identified in the UK, the B1351, the variant first identified in South Africa, and the P1, the variant that was first identified in Japan from travelers from Brazil. We have an additional 7 variants of interest that we are tracking worldwide. B1617 is one of those. Indeed, there actually are a number of virus variants that are being detected around the world, all of which we need to properly assess. This is based on information that we know about its circulation, how much of these virus variants are circulating, and this is determined by the sequencing capacities in country. And as you know, the sequencing capacities around the world vary. In India in particular, the sequencing capacities are increasing as is happening around the world, although we don't have very good eyes and ears to see which of these variants are circulating where. It's really patchy so far. But there's other pieces of information that we are looking at. We're looking at the epidemiology in the situation, in the local setting, in terms of, is there an increasing trends in cases, in ICU rates, in hospitalization, so we're also looking at severity. And then there are a number of lab studies that are underway. So we have a global group of individuals who work together, who meet regularly as part of our virus evolution working group. The B1617 has been discussed with our virus evolution working group, together with colleagues from India, to assess what this variant is and if there are any changes in terms of the epidemiology and the severity of disease that is caused by people who are infected with this. Some of these studies take time to understand if there's an impact on neutralization, if there's any impact on our ability to detect it with currently available diagnostics, if there's any impact on the available therapeutics or vaccines. So there's a number of studies that are underway for the B1617, as well as the B1618 and other virus variants that are circulating. In addition to that, not only do we look at particular variants, but we're looking at specific mutations that are identified in each of these variants. And there are common mutations that are being identified. So what's important by having this global community speak together as an overarching ability globally to monitor and assess these variants, we're putting the right people together in the room to discuss what do these mutations mean. It's a very dynamic process. The information is coming in fast and furious. There are new variants every day that are being identified, that are being reported, not all of which are important. So it's important that we have the proper discussions to determine which ones are of significance from a public health value, meaning does it change our ability to use public health and social measures or any of our medical countermeasures. So this is one that we are actively tracking. We are working with colleagues in India, but the B1617 is also in other countries, so other countries are also doing studies on this particular variant. So we release the information every week in our weekly epidemiologic record, and so you can track the latest information that we have from there and through preprints and publications, which we're also monitoring. Sorry, it's a long-winded answer, but there's a lot of work that's ongoing with these variants because they're so important for us to understand the trajectory of this pandemic and what is happening in each individual country, and we need the global community to be working together, and they are.
Thank you very much, Dr. van Kerkhove. Next question goes to Sophie Mokoena from SABC. Sophie, please unmute yourself.
Sophie Mokoena from the SABC in South Africa. I just want to find out, in terms of the vaccines that are currently being evaluated by the WHO, how far is the WHO with Sinovac and also Sputnik, and perhaps clarity whether China and Russia have presented their reports on these vaccines?
Thank you very much. I think we answered the part on China, but for Sputnik, please, Dr. Simao.
Thank you, Sophie. With Sputnik, which is the Gamaleya Institute in Russia, WHO still does not have the entire dossier. It's not completed. The data is not completed yet, but it's the type of what we call it a rolling submission, so the manufacturers can put in data as the assessment moves forward. Gamaleya, Sputnik V, we have a team in Russia for the past 2 weeks already assessing the good clinical practice for the Sputnik vaccine, and we will start inspecting for the good manufacturing practices now from 10th of May to first week of June. And that's where we'll do the inspections in 5 different locations, 5 different producers. 2 of these inspections are being done together with the European Medicines Agency, and 2 will be done only by WHO. So we expect that as soon as we have the entire dossier, the full dossier, plus the compliance to both good manufacturing practices and the good clinical practice, the vaccine can be assessed then by the technical expert group, and we expect that this is likely to happen end of June or probably in July. Thank you.
Thank you again for these clarifications. We'll move to Carmen Pound from Politico. Carmen, please unmute yourself.
Hi, thank you so much for giving me the opportunity to ask a question. I wanted to ask about the fact that the Democratic Republic of Congo has said that they will give back about 1.3 million vaccine doses from AstraZeneca. And I think Africa CDC said that a few other African countries, without naming them, are in the same situation. I was wondering how worried the WHO and COVAX is about the situation, given that obviously, you know, the Democratic Republic of Congo right now doesn't have so many cases, but as we've seen in India and elsewhere, you never know how things might happen in the next few months. So is anything being done to help countries that, have vaccines, but they're about to expire soon to deploy them? Like, what is happening there? Thank you.
Thank you very much, Carmen. I'm now looking at Dr. Aylward to take this. Thank you.
Thank you very much, Carmen. I'm not sure I know the exact specifics about the case that you mentioned, but we do know that some countries have had concerns about expiry dates related to the doses that they've received. What I'd understood when I heard about this, that this was not actually COVAX, but doses received through another channel, but again, I'm not 100% sure on that. What more important is the second part of what you asked about what we're doing to try and help. And most importantly, this is a piece of work that started back in October, November of last year, where the whole COVAX entity, UNICEF, WHO, the World Bank, others, and many partners and NGO partners on the ground started working with governments on what we call their National Vaccine Deployment Plans, or NVDPs. And those plans have 9 or 10 now different areas of work, everything from ensuring vaccine safety, cold chain capacity, how to manage the communications around vaccine, the planning for rollout, financing, et cetera. And there's been a tremendous amount of work done with all of the countries that are part of COVAX, and especially the 92 what we call advanced market commitment countries, or the ones that receive support and in the form of of the vaccine. So there's been a whole program of work with them to ensure first there was an assessment in these countries across all the dimensions I mentioned, then that a plan was put together, a comprehensive plan, that it was actually financed and then systematically tracked. So all of that was to ensure that the issues like you just received that mentioned are able to be managed, make sure that as countries get vaccines, even with short expiry dates, that they be able to roll them out as rapidly as possible. Now, not every plan goes perfectly, so there have been some bumps in the road and some hiccups in different countries that we've heard about. And every week the teams get together, or actually almost on a daily basis. They systematically look at the lessons that we're hearing, sharing those lessons across regions and countries to make sure as we go forward they get dealt with. So yes, there's going to be some bumps in the road, but there's a huge upfront investment that's been made to try and help countries ensure the smoothest rollout as possible, but still learning as we go, and hopefully the rollout will get smoother and smoother as it goes forward.
Thank you very much, Dr. Aylward. The next question goes to Gabriela Sotomayor from Progreso. Gabriela, please unmute yourself.
Hola, hi. My question is for Mr. Brown. Rich governments are prolonging the global pandemic, but also pharmaceutical companies. So where is the accountability here? Health personnel are dying, elderly. This is very unfair when those countries can help. So do you think that at least they have a moral responsibility? And very, very quick, please, if Dr. Tedros can give a message for journalists who have been arrested, harassed, attacked for criticizing the dealing of the pandemic of their governments. Thank you very much.
Thank you very much, Gabriela. And Mr. Brown?
Well, this is a moral catastrophe if we cannot help vaccinate and provide help to the poorest people in the world. And that's why I think people are determined that in the next few weeks, big decisions be made. And we really are at a point where the G7 and then the G20 have got to make these decisions. So Germany, Norway, United Kingdom, United States of America have provided substantial amounts of resources to Act A and therefore to COVAX. But some countries have yet to contribute. Some countries could contribute more than they've done. And I think over the next few weeks, you will find people trying to persuade governments in each of the G7 countries initially, and then the G20 countries, that there is an ethical as well as economic imperative for taking action to provide for money for vaccinations. And I would see this campaign, you saw a concert last night in Los Angeles, you've seen letters already appearing. Some of the medics themselves have been calling for the vaccinations that they've discovered and have been responsible for to be distributed right across the world. And this will see a great deal of momentum over the next few weeks to persuade us that really you can't rely on just passing the begging bowl around when you've got a crisis of life and death. You can't treat this like a charity fundraiser. You've got to have a systematic plan for equitable burden sharing. And that's what I hope we'll get agreed by June the 11th. And even then, I wish it had been earlier, but this is the point at which a decision can be made.
Thank you so much, Mr. Brown. Dr. Tedros?
Thank you so much for that question. First of all, I said it earlier, but I will repeat, happy World Press Freedom Day. As you know, for the world to have stability and peace and prosperity, democracy is central. And for democracy to continue to be strengthened, the role of the media is very, very important. And strengthening media in each and every country and ensuring its freedom is actually contributes for the stability and survival and development of the country, and also strengthening democracy. So when we celebrate Press Freedom Day, I think each country should realize that protecting the media, protecting journalists is actually to the advantage of each and every country. I call on all countries to work on strengthening strong media in their countries, and at the same time strong democratic institutions. And then the other extreme, of course, is, as you rightly said, journalists are being targeted in many countries, that should not be the case. And we sympathize and our condolences to the families of those journalists that we have lost this year. And we appreciate their heroic services. This day, we have to remember those journalists who are exposing themselves but serving humanity, of course, at the expense of their life. And we respect them. And to all journalists, we respect your role, and please accept our gratitude for your service. And this year, I think, World Press Freedom Day, the theme is information as a public good. And indeed, it's a public good. And thank you so much for using the public good to help with another global public good that is fighting the pandemic. Thank you so much.
Thank you so much, Dr. Tedros and Mr. Brown. It looks like we have time for one more question, and that goes to Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. Dr. Tedros just noted that Sweden is donating 1 million doses of AstraZeneca vaccine to COVAX after France and New Zealand. And we know that the US has shared vaccine doses with India, Canada, and Mexico. I was wondering if WHO, Dr. Tedros, has personally reached out to President Biden for the US to share vaccine with COVAX and help with intellectual property. Have you called the White House to say, hey, President Biden, I know you recently pledged $4 billion to WHO, but there's fire on the mountain and we need all those millions of doses of vaccine that you don't need in the US. Thank you.
Thank you, Simon. And Dr. Tedros, please.
Yeah, thank you. Thank you so much. I'd like to use this opportunity actually to thank the generosity of the US. The Biden administration has already donated, I don't remember the figures, but $4 billion US dollars to COVAX. So I don't want to make a mistake on that. So $4 billion. So that's very, very generous. And that's already the largest contribution. So I would like to use this opportunity actually to thank President Biden and his government. And then on vaccine donation, I think they will do it when they're ready. We see some positive signals now. And as soon as they're ready, they will announce. But we had already engagements and look forward to getting positive news soon. Thank you.
Thank you so much. With this, we've come to the end of the time. Sorry for not being able to take all questions that are still pending, but I will ask Mr. Gordon Brown, our special guest today, United Nations Special Envoy for Global Education and the former Prime Minister of the United Kingdom, for any final words, please.
I just want to say I'm in awe of the work that is done by the World Health Organization, by ACT and by COVAX, and by so many health workers around the world who are fighting to save lives at this very minute. I wanted to follow on from what Dr. Tedros and say I and a number of other former leaders, medics and others have been in touch with President Biden. We've raised the issue of the temporary waiver for the patents. We've raised the issue of dose sharing, and we've also raised the issue of support financially at the G7 for the vaccine to be distributed across the world. So I've got no doubt President Biden, who spoke at the concert last night, is determined to do what he can. But over these next few weeks, as we've said, to support the efforts of the WHO and Dr. Tedros and all those who are working, we will step up the pressure, I can assure you, so that we hope that just as the G7 made big decisions on debt relief and for aid for Africa, and then on HIV/AIDS some years ago, it makes a big decision on June the 11th to support all those who are in need of vaccination. We cannot have a two-speed world and a divided world as a result of a vaccination that has been discovered but is not yet available to everyone who needs it.
Thank you so much, Mr. Brown, for your participation. Thank you all for your participation here. We will be sending the audio files and Dr. Tedros' remarks, and as well also Mr. Brown's remarks afterwards. The full transcript will be posted on the WHO website tomorrow morning. For any other follow-up questions, please send an email to mediainquiries@who.org.